All right, so welcome to the practice. I want to show you how we're going to use a low-level light therapy. This is a device that you're going to get. It's going to come in a box like this. Very simple. We open it up. Inside there's an instruction manual. We're going to give you instructions in this video and written instructions, so you can read through this if you like, but please just disregard it, except for any warnings. So here's your power supply. It comes wrapped up. You've got a power supply that's going to plug into any 110 outlet, and on the other side here we have a male end that will go right into this part of the power supply. Just plug it in like that, and then of course this will plug into the outlet, which we're going to do in a second, and we're going to unbox this, unwrap it. So on this one, there again is a male end, a little different shape. You're going to take it into the device that has the LEDs. You're going to just slide that right out of the package. And it plugs in here, and then it screws on, kind of like you'd screw in a TV cable to a TV. Just like that. Now, I'm already prepared. I've got my shoes off. I'm going to show you how to use this. Let me go ahead and get it plugged in. All right, so the great thing about this device is it has a really long cord, and it's pretty hard to mess up from a treatment standpoint. It has a red light, and when you push that red button, the red light comes on. That's your red light and your near infrared LEDs. This will run for 1 minute once you push the button. So once you push a button, just let it go until it stops. So different areas we're going to treat. We're going to treat the foot. So we'll start on the left foot. We'll hit the button, and we're going to hold that just basically right at the surface of the skin. If you feel it gets too hot, go ahead and take it out a little bit. You're going to hold it right at the surface of the skin. We're going to treat the bottom of the foot for 1 minute. Once that 1 minute's done, your machine will stop glowing. And then we're going to come to the back of the leg and the calf area. Hit the red button, same thing, right there for 1 minute. So you do that on the left side and the right side. If you're doing your hands, you would go ahead and do a minute on the left hand and a minute on the right hand. And for anybody who's treating the feet, unless you've got hardware in your low back that we've talked about, we're going to treat an additional area right here in the small of the back. Of course, this needs to be skin on skin, so you wouldn't treat it through the clothes. That is the near infrared LZR device.
Hey guys, I'm here to show you how to set up your rebuilder. So when you open the packet, it's going to come with some instructions. You'll also have a little yellow bag. So this is your rebuilder unit. It also comes with a set of leads. And what you're going to do, you'll open your leads, and they plug in right on top of the rebuilder unit. The big thing is that this little silver circle on the leads has to go towards the front. Just like this. From there, you are going to take your yellow bag, and inside of it you have 2 rubber leads. And they will plug onto the end of your rebuilder leads. There is a tiny hole right on this lip. There's a ledge, and that is what it goes right up against. And you twist and slide it in. And then you have your rebuilder set up. I'm going to show you how to set up your rebuilder treatment at home. So the first thing you're going to do is you have your rebuilder bucket. There is a little ledge in here. I want you to fill up the bucket with warm water about to that ledge or to where your feet are submerged. Once you have your bucket of water, you will take your electrolyte solution and you're going to spray on top of the water 5 times on each side. From there, your bucket's ready to be used. So you're going to place both your feet in the bucket Both feet have to be in the bucket for the machine to work properly. You'll take your rebuilder unit and you will drop one rubber lead on each side of the bucket. They don't have to touch your feet, they just have to be in the water. At this point, you can go ahead and start to turn your rebuilder on. Turn it up to where you can feel it. I don't want you to be in any pain or discomfort, but I do want you to feel the sensation. The machine will run for 30 minutes, and once it's done, it'll shut off on its own. Just be sure to click it back to off so that you don't drain your battery. I'm going to show you how to use your nerve plate. You should have received it in the mail by now. When you open it up, you will just plug it right into a wall outlet. From there, you can turn it on with the switch on the back. It'll light up red. And then what you're gonna do is rest your feet on top of it. Wait about 30 seconds and it will go ahead and turn on. You'll feel it. We want you to do this at least 3 to 5 times a week for approximately 10 minutes.
All right, welcome. So the next thing we're going to do is talk about how to use your comprehensive nutrition neuropathy support kit. So the main purpose of this nutrition is to improve blood flow. So you're going to have one thing that you take by mouth and one thing that you do topically. This product is called VasoPro. There's a scooper in here. You're going to take 1 scoop of this VasoPro twice per day. So mix it in cold water, or you can mix it in a juice if you prefer the flavor of that. If you're diabetic, make sure if you're using a juice, it is a low sugar juice sweetened with stevia. And so yeah, 1 scoop in water or juice, and take that twice per day. I will say a lot of our patients prefer to have that water or juice cold. So if I'm taking my nutrition in the evening, my VasoPro, I'm going to make sure that I've already made that up several hours ahead of time. Most people will do it when they take their morning nutrition, let it sit in the refrigerator, and then just give it a quick swirl and wash that down. It does taste better when it's cold. The other thing we're going to talk about today is NeuroSoothe. NeuroSoothe is a topical vasodilator, helps to open up those blood vessels and get blood flow. So with this, you're going to apply it 1 to 2 per day on the affected area. A little bit goes a long way. Anything just about the size of a drop of a pea, or the size of a pea rather, and put that on your feet or anywhere that's affected. It's going to help to calm that area down, open up those blood vessels, get oxygen and nutrients to those areas, and really help to calm down those symptoms until we get some long-term change for you. And that's it. So this is how we're going to improve circulation by mouth and topically.
Hi, I'm Taylor. I'm the health coach here at Aligned Health and Wellness. As you begin your peripheral neuropathy program, I want you to know that you're not doing this alone. I'll be checking in on you every 2 weeks for your coaching calls. These calls are a chance for us to connect, talk about how you're feeling, and make sure that you're comfortable and confident with your treatments and supplements. We will also go over dietary recommendations and talk through what to expect as your body begins to heal. If you ever have questions, concerns, or run into any challenges along the way, that's exactly what these calls are for. My role is to support you, help keep you on track, and make this process as smooth and successful as possible. I'm here to help you get the most out of your care every step of the way. I look forward to working with you and being a part of your healing journey.